Hello, Mr. Olagues. My name is Jesus, and I'm going to be performing a physical assessment on you today. If you don't mind, I'm going to go ahead and wash my hands. Um, so basically, all we're going to be doing is I'm going to be going over your body systems, pretty much from head to toe, checking for any abnormalities. I'm going to be asking you some very basic questions regarding your health and your activities of daily living.
Okay.
Do you have any questions?
No.
No? Alrighty, so if I could just take a look at your armband, please. Thank you. Alright, and then can you confirm your last name?
Olagues, Olaguez.
Okay, let me go ahead and close this door behind us. Alrighty, can you also confirm your date of birth, please?
2472.
Awesome. Okay, and where are we today?
What?
Where are we today?
The hospital?
Alrighty. And before we get started, do you have any allergies that you are aware of to any food or medication?
No.
No? Alrighty. And what about any pain anywhere throughout your body?
No.
No? Okay. Awesome. Alright, so first thing, we're going to be taking your vitals really quick. I'm going to be taking your blood pressure, if you don't mind. So if you don't mind just rolling up your sleeve. If you don't mind just extending your arm. Let me know if the cuff is too tight, okay?
Mm-hmm.
Is that fine?
Yes.
Awesome. All right. Alrighty, so for our patient here, he is displaying his stated age, is showing no signs of poor hygiene, not letting off any body odors, indicating that he has overall good hygiene. He had a regular blood pressure with a systolic pressure of 126 over a diastolic pressure of 87. His heart rate and respirations are intact and no signs of any respiratory problems. So next, Mr. Olagues, we're going to be jumping into the skin, hair, and nails assessment. And within the past, have you noticed any changes in your skin, such as any color changes in your skin, the development of any moles, or
No.
or any changes in your skin texture?
No.
No? Okay. So I'm just going to be assessing your skin, if you don't mind. I'm just checking for any changes, any leathery patches of skin. Alright, so the patient's skin color is in accordance to his ethnicity. He has a regular smooth skin texture to him, regular body temperature as well. There is no leathery patches on the skin, indicating that there has been no previous scars or any trauma to the skin. So next, I'm going to be assessing your hair, if you don't mind. I'm just going to be feeling your overall head, checking for any bumps and masses.
Okay.
So I'm going to put on some gloves to assess your hair. Do you mind if I touch your scalp?
No.
patient shows no signs of pediculosis, indicating lice. He has even hair distribution throughout, even hair color throughout. Also showing that there is no hair loss either. So now I just need to assess your nails, Mr. Largus, if you don't mind, if I could just see your nails. I'm going to be checking the capillary refill on them. And just your thumbs. Perfect. All right, Mr. Largus. And then if you don't mind bringing your two fingers, pointing fingers together and putting them together just like this, nail to nail. And you should be able to see a little diamond between the nails. Yeah, so there's a little there's a diamond.
Yes.
So after checking Mr. Alagus's nails, we noticed that the nails were intact. They were a normal color. After we checked for any hypoxia, after checking his capillary refill, we noticed that his color in his nails went back to the same color within less than 3 seconds, indicating that he has no signs of hypoxia. And he also is showing no signs of clubbing in the fingernails due to the diamond that was displayed in his nails. So next we're going to be assessing the eyes, ears, nose, mouth, and throat. So really quick, Mr. Largus, have you experienced any problems with your vision or hearing?
No.
No? Do you use any contact lenses or glasses?
No.
Do you use any hearing aids?
No.
No? Okay. Have you experienced any drainage from your ears or your nose?
No.
No? Do you get any regular nosebleeds?
No.
No? Okay, so patient is showing even ears and an even nose. Same with the eyes. So we're going to be covering your cranial nerves. So for the first cranial nerve, which is your olfactory, we're going to be checking your sense of smell. So I'm going to pass a object under your nose while you have your eyes closed, and you have to respond to me as to what that item is, okay? So if you don't mind just closing your eyes.
Coffee.
Yes, sir. All right, so olfactory nerve number 1 is intact. The patient was able to describe the correct sense of smell. So for the next cranial nerve, we're going to be doing our optic nerve. So basically all I'm going to be doing is I'm going to be bringing this item around, and you're going to be telling me when you are able to see it, keeping your your vision straight, okay? This is checking your peripheral vision. So just let me know when you see the object, okay?
Yeah.
Okay.
There.
All right, so patient's optic nerve is intact. Patient was able to identify the object on his peripheral at the same distance on both his left and right eyes. Moving on to the next cranial nerve, which is the oculomotor, tracheal, and abducens. So this is going to be checking for cranial nerves 3, 4, and 6. To do this, we are going to be performing the cardinal field of gaze. Basically, Mr. Largus, all I'm going to be doing is shining a light in your eye, and all you have to do is just follow the light with your eyes, okay?
Okay.
All right. Okay, next time. So what we did is we had the patient follow our light with both of his eyes from each corner to each corner, from top to bottom, and from side to side, and on both eyes he was able to follow the light, indicating that his cranial nerves 3, 4, and 6 were intact. Next, we're going to be assessing your trigeminal nerve. So all I'm going to be doing with this is I'm going to be bringing 2 objects to your face, and you are going to tell me which one is the sharp and which one is the soft. So just for reference, this is the sharp and this is the soft. So if you don't mind just closing your eyes, and as I top your different portions of your face, just tell me what object it is that you feel, okay?
Okay. Sharp. Soft. Sharp. Soft. 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 Sharp. Sharp. Soft. Soft.
So patient is indicating that his cranial nerve number 5, the trigeminal nerve, is intact. He was able to differentiate between the difference of sharp and soft in all 6 areas of his face. Moving on to the next nerve is going to be the vestibulocochlear nerve, which is cranial nerve number 7. And what we're going to be doing in this is we're going to be assessing your ears for your hearing. So I'm going to be standing behind you. I'm going to name 3 terms. I'm going to whisper them to you, and you have to repeat whatever I whisper to you, okay?
Okay. John 17:5.
And next year.
Mike 7:3.
So patient's cranial nerve number 7 is intact. After conducting the whisper test, he was able to repeat the terms that were repeated to him. Moving on to the next cranial nerve, we have the vagus. So with this, Mr. Lagas, we're going to be checking your vagus nerve, which is in control of moving your tongue. So if you don't mind just sticking your tongue out and moving it up and down, side to side. Okay, so patient's cranial nerve, vagus nerve is intact. He was able to move his tongue up and down and side to side. And that is also good for checking our patient's hypoglossal nerve. And the last nerve we're going to be checking is vagus nerve number 11, which is the accessory nerve. So basically, Mr. Lyons, what we're going to be doing is I'm going to be applying my hand on your cheek, and you're going to be applying resistance. So as I'm applying resistance, you're going to be going against my hand. Okay. So going to. Okay. So cranial nerve is intact. He was able to apply resistance on my hand, indicating that there were no problems with any of his cranial nerves. After, we are going to be assessing for his temporomandibular joint. So basically, I'm going to be putting my thumbs on your chin, and you're going to be opening and closing your mouth, okay?
Okay.
All right, go ahead and open your mouth. Close. Open. Close. Okay, so as we were palpating the joint, and as the patient was opening and closing their mouth, there were no cracks, indicating that there was no crepitus, showing us that the patient's temporomandibular joint is intact. If you don't mind just opening up your mouth, opening wide, Mr. Lagas, we're going to be checking for your tonsils. So after checking the inside of Mr. Lagas' mouth, we found that there were no lesions, no drainage, indicating that his tonsils were intact. And now I'm just going to be assessing your pupils. So patient's pupils are intact. After conducting the Perla test, we found that the patient's pupils were the pupils were equal, round, responsive to light, and they were accommodative as well. Moving on to the next assessment, we're going to be moving on to the neck assessment, where we're going to be assessing the range of motion of the neck, assessing the trachea, and palpating the lymph nodes. So for the first assessment, if you don't mind bringing your ear to your shoulder, okay, and then to the other side as well, okay, and if you don't mind looking back, okay, and then bring your head to your chest. So patient's range of motion on his neck is intact. Patient was able to conduct all ranges of motion, indicating there are no issues with his neck. So next for your trachea, Mr. Lug, if you don't mind just extending your neck, just going to be checking your trachea. Okay, so after assessing the patient's trachea, I found that his trachea is intact, it is standard, indicating that there are no breathing problems and no issues with his possible deviations of the trachea as well. Now I'm going to be assessing your thyroid isthmus muscle. So if you don't mind, same thing, bring your head a little forward, and if you don't mind just swallowing. Okay, so after swallowing, we saw that the patient's trachea and his thyroid did lift up, indicating that there are no issues with his thyroid isthmus. And now we are going to be assessing the eight lymph nodes in your face, Mr. Lagas. So if you don't mind, I'm just going to be bringing my fingers, just assessing that you don't have any swollen or inflamed lymph nodes, okay?
Okay.
So right here in the back, we're going to be assessing for his occipital nodes. His post-auricular behind his ear. His pre-auricular. And we're going in circular motions. Mandibular lymph nodes. All right, so we assessed all the patient's lymph nodes. We ended with the submandibular lymph nodes. We assessed the preauricular, which were in front of the ear, the postauricular behind the ear, deep cervical, which were on the neck, the posterior cervical, which is the back and base of the neck, the submandibular on his jawline, the occipital behind his neck, the supraclavicular above his clavicle, and the superficial cervical in the middle. So after palpating all of his lymph nodes, we found that there were no signs of any inflamed lymph nodes. After, we're going to be moving on to the respiratory. So Mr. Lagas, in the past, have you experienced any difficulty breathing or any frequent colds or anything like that?
No.
Anything similar? No? Okay. All right, Mr. Lagas. So next, we're going to assess your anterior to posterior lateral ratio. So with this, we're gonna do it by using your own hands. So you are going to bring your thumb right here to where your scapula ends, and your middle finger is going to be brought right here to the top of your rib cage, and that should cover your front to back. Awesome. Next, we are going to bring your thumb to your shoulder. And after, you are going to bring your middle finger to your middle chest. Okay, and now with the other side as well. Okay. Perfect, thank you. So after assessing the patient's anterior to posterior lateral ratio, we found that it was a 2-to-1 ratio, which is a normal finding. By this normal finding, we find that the patient doesn't have any signs of COPD. He's not displaying a barrel chest. His breathing is normal. He is not using any accessory muscles to breathe. His breath sounds are not forced. There is no wheezing, indicating that his respiratory is intact. Next, we're going to be moving into, I'm going to be oscillating your posterior lung sounds. I'm going to be auscultating the 4 areas in the front, the 4 areas in the back, and the 2 areas laterally. So every time you feel my stethoscope in a different area of your chest, just go ahead and take a deep breath. So once I start, take a deep breath. When I move my stethoscope, go ahead and take another deep breath, okay? So for the first one, we're going to be doing the upper lung lobes, which is right under the clavicle of the patient, which is also the first rib. So we're going to find the patient's clavicle right here, and we're going to auscultate. So go ahead and take a deep breath, Mr. Vargas. Okay, so both upper lung lobes on each side of the patient, both left and right, are intact. There are present breath sounds. There are no signs of wheezing or any murmurs. Following, we're going to be moving into the lower lung lobes of the patient. We're going to find the patient's sixth intercostal rib and assessing from there. So it's going to be close to the abdominal. If you don't mind just lifting up your arms, so we're going to find the sixth intercostal rib. So we found the sixth rib. Okay. Awesome. Okay. So now we're going to be assessing the posterior lung sounds of the patient. So for the posterior, we are going, for the posterior upper lung lobes, we're going to have the patient bend his neck, bring yours, and we're going to find, so right here we find our C7, and right under our C7 is our T1, and we're going to move it both left and right to assess the upper lung lobes of the patient. Okay, so in both posterior upper lung lobes, we found present breath sounds with no complications of breathing. And to finish the auscultations, we are going to begin on our lower lung lobes. And to find our lower lung lobes, we're going to find where the patient's scapula ends. So we're able to find the patient's scapula right here, and this is where we will be auscultating for those lower lung lobes. So present breath sounds in the lower lung lobes, indicating that all the areas that were auscultated are intact. Okay, and now moving on to the cardiovascular system. Mr. Vargas, have you experienced any palpitations or chest pain, any issues with your circulation?
No.
No? Okay. So I'm going to be assessing the patient for edema. The reason we assess for edema is to make sure that the patient's circulation is intact and to know that he is having efficient blood flow both in his arteries, to his peripherals, and in his venous system going back to his heart. Okay, so if I don't mind seeing your wrist, right here's fine. Okay, and now your ankles, please. All right, so the patient has no swelling in either his wrists or his ankles, and after me pressing my fingers in his wrist bone and his ankles, there were no indentations left, indicating that the patient has no edema. Okay, and now following, we're going to be assessing the brachial, radial, and pedal pulses. So for your brachial pulse, if I don't mind just seeing your arm, Mr. Vargas, we're going to find it right here, almost in the indenture, where his arm bends, and that's going to be his brachial pulse. Following, we're going to be assessing his radial pulse, which is on his thumb side. And his ulnar, which is on his pinky side. Okay. And now we are finally going to be assessing his pedal pulse. So if you don't mind, I'm going to be assessing the pulse on your foot. Okay. So when we assess the pedal pulse, we are assessing right under his toes. And in all his pulses that we assessed, which was the brachial, radial, ulnar, and pedal pulse, we found that his pulse was regular. It was +2, and the pulse was present. I'm sorry, and symmetrical as well. And now to chest for symmetrical, we also need to assess on his left side his pulses as well, the same ones we assessed on the other arm. Brachial, radial, ulnar, and pedal are all intact. They are +2 and symmetrical. Okay. And after noticing the patient's chest expansion, we notice that he has a regular chest expansion, and we are noticing that his breaths are normal. His expiration is almost twice as long as his inspiration. And now to assess the carotid pulse, to assess the patient's carotid pulse, we are going to have the patients bring our fingers to the patient's neck. Okay, and the patient's carotid pulse is present as well. And this, for this pulse, is the pulse that we only take one at a time to not affect the patient's blood supply to the brain. Okay, next we're going to be assessing the patient's apical pulse, which is the point of maximum pressure. And it's found in the mid-clavicular in the 5th intercostal space. For males, it's going to be right at the nipple line. So if we bring our 2 fingers here to the patient, we are able to find that that pulse is present. It's +2 and is present. And moving on to the abdominal and genitourinary assessment. Mr. Lagas, have you experienced any changes in your dietary habits?
No.
No. What do your normal dietary habits look like? What do you normally eat on a daily basis?
Just eggs in the morning, a sandwich or a hamburger and lunch, and a light dinner.
A light dinner. Okay. And for your bowel patterns, have you noticed any changes in your bowel patterns? I'm sorry.
No.
No. And your urinary patterns?
No.
No. Is there any pain accompanied with any bowel or urination?
No.
Oh. Okay. So for purpose of the recording sake, we are not able to lie the patient on a bed due to the recording. So we are going to be auscultating the patient's abdomen and sitting, and we're going to be assessing for bowel movements in all 4 quadrants. So I'm going to be assessing your bowel movements, and I'm going to start at the first upper quadrant right here. So we were able to find bowel sounds in all 4 quadrants in the patient, indicating that he has normal bowel movements. Next, we're going to perform our light and deep palpation, checking for any masses or any pain. So for our light palpation, we're going to bring our 2 fingers, just feeling the patient's abdomen in all 4 quadrants. Just really light touches. Okay, and then for our deep palpation, we're gonna press a little harder. If at any point it gets too hard, just go ahead and let me know, okay?
Okay.
So we're gonna be coming in a little deeper. Okay, so with our light and deep palpation, there were no abnormal findings. The patient also indicated that there was no pain, which is a sign for a normal abdominal system. Okay, following, we're going to be percussing the abdomen, just making sure that we are having all the right sounds. So I'm going to assess each quadrant of yours. I'm just going to be pressing your hand right here. Okay, so we were able to get the percussion sounds that we were looking for, which were the tympanic. Up here in his upper right quadrant, the sound did become more dull just because of the fact that his liver is there, which is a normal finding when we percuss the patient's liver. Moving on, we're going to be moving on to the musculoskeletal and neurological assessment. Mr. Lagas, have you experienced any pain or trouble walking or any difficulties with your day-to-day activities?
No.
No? Okay, Mr. Lagas, and if you don't mind just standing up, I'm going to be assessing your walking. Okay, and if you don't mind just walking in a straight line, just forward, and then just coming right back. Okay. So, all right, Mr. Lagas, go ahead and have a seat. Okay, so we assess the patient's gait. He has a steady posture, no leaning and indicating a normal spine, no trouble with his balance either. The patient also reported no difficulties with his activities of daily living. Moving on, we're going to be assessing the patient's muscle strength in both his upper and lower body. So for your upper strength, we're going to have the patient squeeze our fingers. So go ahead and squeeze my fingers, Mr. Lagas. Okay. So the patient was able to squeeze my fingers, indicating that he has intact upper muscle strength. Following, we're going to be moving on to the patient's legs. So I'm going to be applying resistance, Mr. Lagas. So you're going to be bringing your hands up against your legs up against my hands. Okay. And now we're going to do the opposite. You are going to be bringing the resistance against my hands. Okay. So the patient did provide resistance in both the upper and lower. Indicating that his muscle strength is intact. Next, we're going to be assessing his range of motion on his shoulders. So if you don't mind doing a swimming motion for me, Mr. Lagas. There we go. So patient is providing accurate range of motion in the shoulders, indicating no problems. So for your wrist, Mr. Lagas, go ahead and bring your wrist out like that, flat, and I'll bring them up and bring them down, and I'll go ahead and twirl. Okay, so patient has normal range of motion in his wrist. Okay, and then for the hips and the ankles, we are going to require for you to stand up, Mr. Lagas. So the first one we are going to be assessing is your hip range of motion. So for this one, you're going to be bringing your leg out just like this, and then bringing it in and then out, okay? So I can help you with your balance on this one. Perfect, and now with your next one. Okay. So moving on, we're going to be assessing the patient's ankles. So pretty much the same thing we did with your wrist. Just go ahead and bring your ankles out, side to side, up and down, and go and twirl them. Okay, so the patient showed normal finding in all of his shoulders, wrists, hips, and ankles. And to finish off the assessment, we are going to be conducting tendon reflexes, which is we're going to be conducting the patellar, Achilles, and Babinski tendon reflexes. So for the patellar, we are going to be using our kitchen utensil as a reflex tool. So we're going to be coming right here, right under where the patient's kneecap ends, and we're going to be looking for a reflex. Okay, so we're going to be just coming in with the flick of the wrist to not hurt our patient. So that should indicate reflex as we saw in the patient's leg. And then we're going to do it for both sides as well. Okay, So the patient's reflex is intact on both sides. So indicating he has a good patellar reflex. Moving on, we're gonna be going into our Achilles reflex. So to find our Achilles, it's gonna be in the patient's, behind the patient's ankle, right here where we feel that little rubber band, almost. So we're gonna have the patient come up, and we are gonna be applying our reflex tool. And there was reflex on his right leg, and now we're gonna be moving on to his other leg. Okay, and there was a reflex there as well. And to top off our assessment, we're gonna be doing the Babinski reflex. So we're gonna be running the reflex tool under his toes. If the patient has any curling of the toes, you may indicate that he has a negative Babinski reflex. The normal finding that we're looking for is that the patient has no reaction. Okay, next one. Okay, so there was no movement in the patient's Babinski reflex, which is the normal finding that we were looking for. And with this concludes our head-to-toe assessment. Thank you, Mr. Lagas, for being with us.